Cold feet are one of the very first signs that the heart might be struggling. When the heart muscle begins to lose its ability to pump blood efficiently, the body switches into an energy-saving mode. It starts prioritizing blood flow to essential organs like the brain, heart, and lungs, which means circulation to the extremities drops. As a result, the feet stay constantly cold, even on warm days or when the rest of the body feels perfectly fine. Unlike regular cold feet, which usually improve once you walk around or put on warmer clothes, cold feet caused by heart failure stay cold all the time. Even thick socks, blankets, or closed shoes don't warm them up. This happens because the blood flow is simply too low for heat to reach the tissues in the legs and feet. It's a subtle sign, but an incredibly important one that people often ignore because it seems harmless. In older adults, this symptom is even more common since circulation naturally becomes less efficient with age. But when the feet are consistently cold and pale, it's something that deserves real attention. It may indicate not only slow circulation but also a weakening heart and the early stages of congestive heart failure. Noticing this difference can prevent major complications in the future. The smartest thing you can do is not underestimate it. Persistent cold feet aren't just uncomfortable, they're a warning that blood isn't being distributed the way it should. Seeing a cardiologist and getting circulation tests can help detect heart failure early, allowing treatment to start before things get worse. Your body speaks through these signs, and listening to them can literally save your life. Swelling in the legs and ankles is one of the clearest signs that the heart is struggling to pump blood properly. When blood flow slows down, some of the fluid that should be circulating begins leaking into the tissues, especially in the lower parts of the body, where gravity pulls the strongest. This fluid buildup causes what we call edema, making the skin look stretched, shiny, and heavy. It's a common symptom, but a dangerous one because it shows the heart is already under stress. A simple test can help identify what doctors call pitting edema, the type commonly seen in heart failure. Just press your finger on the swollen area for about 10 seconds. If it leaves a deep mark that takes a while to fade, it means there's fluid trapped under the skin. That little finger dent is a quiet but important warning that the heart isn't pumping well and the body is struggling to get rid of excess fluid. In heart failure, the right side of the heart, the part responsible for receiving blood from the veins and sending it to the lungs, loses some of its strength. Because of that, blood starts pooling in the legs and feet, increasing pressure in the veins and forcing fluid out into the tissues. The result is constant swelling that gets worse throughout the day and doesn't fully improve with rest. Unlike normal swelling, this one shows up again every single day. Ignoring the symptom can be risky, because pitting edema means the body is retaining more fluid than it can handle, and this can lead to serious heart and lung complications. Watching daily for increased swelling, stiffness, or deeper marks when pressing the skin can make all the difference. When those signs appear, seniors should seek medical care right away. Detecting and treating the cause early can stop heart failure from progressing. Before we continue, how about supporting the channel and joining our community? By becoming a member, you help keep this work going and gain access to exclusive videos and content. Just click the button next to subscribe and join our health team. Sudden weakness in the legs without any clear explanation is another important sign that the heart may not be delivering enough blood to the muscles. In heart failure, circulation becomes compromised and oxygen, which muscles need to produce energy, doesn't reach them properly. This causes constant tiredness, heavy legs, and a lack of strength even for simple everyday tasks like climbing stairs or walking short distances. Unlike normal fatigue, which improves after resting, weakness caused by poor circulation tends to persist and slowly get worse. Even light activities like getting up from a chair or taking a few steps can feel unusually exhausting. This happens because the leg muscles stop receiving the nutrients and oxygen required to function well, becoming less resistant and more prone to fatigue. Medical research shows that people with heart failure often have lower levels of essential proteins in their muscle fibers, which reduces their ability to contract. In practice, this means the muscles lose strength even if the heart is being treated with medication. This weakness doesn't come from age or lack of exercise alone. It's directly connected to how well the heart is pumping and how well the body is being oxygenated. So if your legs suddenly feel weak, or if the smallest effort leaves you wiped out, see a doctor. Muscle weakness can be one of the earliest warnings that the heart is working beyond its limits. Recognizing the symptom early is crucial to adjusting treatment and preventing heart failure from getting worse, helping you maintain energy and quality of life. A sudden increase in weight, even without changes in diet, is a classic sign that the body is retaining fluid due to heart failure. When the heart loses strength, the body begins storing fluid in the tissues, especially in the legs, ankles, and abdomen. This makes weight shoot up quickly, sometimes by 4 to 10 pounds in just a few days, without any real gain in fat. It's a clear sign that the body is out of balance and the heart needs immediate attention. This type of weight gain is completely different from slowly gaining weight through food or inactivity. It comes on suddenly, usually accompanied by swelling, tightness in the legs, and difficulty putting on shoes. The increase in body volume is caused by fluid that the heart can't circulate properly, which overwhelms the kidneys and worsens retention. It's a dangerous cycle that can lead to serious complications if not treated. Patients with heart failure often notice the swelling starting lightly, then becoming obvious, especially at night. Clothes fit tighter, and weight can change dramatically from one day to the next. This fluid buildup shows that the body is struggling with too much blood volume, something the heart can no longer manage. It's a sign that the circulatory system is under intense pressure. That's why monitoring weight daily is essential, especially for those with a history of heart issues. A gain of more than a couple of pounds in a short period should be reported to a doctor right away, as it may mean the heart failure is worsening. Catching this sign early allows for treatment adjustments that can prevent further overload on the heart. Your body always gives warnings, and weight is one of the clearest ones. When blood isn't properly oxygenated, it tends to pool in the extremities, giving the legs and feet a bluish, purplish, or dark tint. This symptom, called cyanosis, is one of the most visible signs that the heart is failing to circulate blood the way it should. It happens because blood flow slows down and oxygen doesn't reach the tissues, making the skin cold and discolored. This color change usually starts in the toes and lower legs and becomes more noticeable when the person is standing or sitting for long periods. In older adults, the bluish tone is often mistaken for simple poor circulation, but when it's constant, the cause is often cardiac. A weakened heart can't push blood back through the body strongly enough, and the result is a visible lack of oxygen in the skin. Cyanosis is a sign that the body is struggling and that the tissues are starving for oxygen. If the discoloration doesn't improve with movement or warmth, medical attention is needed right away. Catching this change early can prevent heart failure from progressing to a more severe stage. Continuous swelling in the ankles is another clear sign of congestive heart failure and shouldn't be taken lightly. When the heart weakens, it loses its ability to pump efficiently, causing fluid to collect in the lowest parts of the body. Gravity pulls that excess fluid into the ankles, making them swollen, heavy, and often painful by the end of the day. Unlike normal swelling caused by heat, fatigue, or standing too long, swelling from heart failure doesn't go away with rest. It gets progressively worse, making shoes tighter and the skin more stretched and shiny. Pressing a finger on the swollen area leaves a deep mark that takes a while to fade, a clear sign of fluid retention. This symptom reflects increased pressure in the veins and the heart's difficulty sending blood back to the lungs. Over time, the excess fluid can spread to the legs and even the abdomen, making it harder to breathe and putting even more strain on the heart. It's a direct warning that the heart is under stress. Noticing daily, persistent swelling means it's time to seek medical evaluation. Early treatment helps control fluid retention and improves heart function. Elevating the legs, reducing salt, and following medical care can ease symptoms and prevent more serious complications. Wounds on the legs or feet that take a long time to heal are a major warning that blood isn't reaching the tissues properly. In heart failure, weakened circulation reduces the oxygen and nutrients needed for cells to regenerate. The result is slow healing, wounds that linger for weeks, and a higher risk of infection, especially in older adults. These wounds may start as small cuts or scrapes but quickly become painful and difficult to treat. Poor circulation also weakens the immune system, making it harder for the body to fight bacteria. That's why minor wounds can turn serious if not cared for quickly. Redness, swelling, or discharge are signs of infection and should be taken seriously. The problem is that these wounds are often mistaken for complications of diabetes or regular injuries. But when related to heart failure, they reveal that the heart can no longer supply the extremities properly. This reduced blood flow requires urgent medical care, as it can escalate into dangerous complications. Daily foot and skin care is essential. Keeping feet clean, hydrated, and protected from injuries helps prevent infections. If a wound doesn't heal after a few days or continues getting worse, seeing a cardiologist or vascular specialist is the best option. Slow healing is the body's way of saying something deeper is wrong, and the heart needs attention. Numbness and tingling in the feet are common symptoms in seniors, but when they persist, they may signal that the heart and circulation are compromised. In heart failure, blood struggles to reach the extremities, depriving nerves of oxygen. This lack of blood flow causes tingling, sharp stings, or even total numbness, making it harder to feel the ground while walking. Some people describe it as walking on pins or having their feet constantly asleep. Besides the discomfort, pain in the calves while walking, especially after just a few minutes, is a sign that the muscles aren't getting enough oxygen during activity. This pain improves with rest and is known as claudication. It shows that both the heart and the arteries are having trouble supplying the legs with the blood they need, reducing strength and endurance for basic tasks. These symptoms shouldn't be ignored because they show that heart failure is already affecting peripheral circulation. Over time, numbness and pain can worsen, affecting balance and increasing the risk of falls. Reduced sensitivity also makes wounds and infections more likely, and those wounds take much longer to heal. To ease discomfort and support circulation, habits like regular walking, stretching, and avoiding smoking can help. But if symptoms persist or worsen, seeking medical care is essential. Numbness, pain, and tingling aren't just annoyances, they're warnings that the heart needs care and monitoring.